Body temperature. The usual thing patient comes to hospital with is that he has a rise in temperature and there's a fever association. That's the one of the important sign which patient notices and presents to you as symptom. Temperature, the core body temperature, is measured either under the tongue or rectum. Usually, the routes of measuring includes oral, under the tongue. The thermometer is kept for 3 minutes. Rectal temperature, zero point 0.5 degree more than oral temperature. The thermometer kept in the anal canal, 4 to 5 centimeter deep, for around 3 minutes. Usually in infants, that's how we measure. Then axillary temperature, zero point 0.2 degrees Celsius less than oral. The shoulder is adducted and the thermometer is kept in the axilla. The normal temperature in degrees Celsius is 37 to 38, and in degree Fahrenheit is 98.6 to 100.4. At least know the normal value of temperature. Next, fever. What is fever? Fever, elevation of body temperature more than the normal. So, when the examiners have to check your basics, that's the one of the question which the examiner tries. So be thorough with it. To make it very easy, have approximated and round off the values. For degrees Celsius, just make sure you add 1 degree to every subsequent grade of fever. And for degree Fahrenheit, 2 degree Fahrenheit. For example, if normal is 37 to 38, mild fever will be 38 to 39. We have added 1 degree Celsius. Moderate 39 to 40, severe 40 to 41. Hyperpyrexia will be more than 41 degrees Celsius. Similarly, in Fahrenheit, 98 to 100, we add 2 degree Fahrenheit next, 100 to 102, 102 to 104, 104 to 106, and for hyperpyrexia it's more than 106. Then when you have went through all of this, make sure you just go through hypothermia once. Hypothermia is nothing but less than 36 degrees Celsius and less than 95 degrees Fahrenheit. Then we'll divide types of fever: acute fever, subacute, chronic. Acute fever, uh, because when you mention in your history of presenting illness, you usually use fever acute in onset or sudden in onset or chronic fever. So to be specifically clear, acute fever less than 7 days of duration of fever. So it's usually seen in malaria, viral upper respiratory tract infection. Subacute fever less than 2 weeks, seen in typhoid. Chronic or persistent fever more than 2 weeks. As you can think, the only first disease which can come to your mind is HIV, TB, and cancer. Then we look at the night sweats. Usually we see in TB, brucella, subacute bacterial endocarditis, nocardia, lung abscess, and arteritis nodosa. Then hypothermia, anything which is less than 36 degrees Celsius or which is less than 95 degree Fahrenheit. The causes include hypopituitarism, hypothyroid, stroke, Parkinson, multiple sclerosis, cold immersion, cold infusion, pancreatitis, sepsis, prolonged cardiac arrest. Next, one of the favorite questions of examiners: fever types. No, so when we make it or convert it into graphical form, it will be easy to remember. So first, continuous fever, wherein there is a rise in temperature from the baseline, and at one point it fluctuates within 1 degree Celsius. So it doesn't touch the baseline and it fluctuates within 1 degree Celsius. That's the continuous type of fever. It's seen in lung abscess, lobar pneumonia. Next, remittent fever. Even this, here there is a rise of temperature, but at one point it fluctuates more than 1 degree Celsius. In continuous, it was less than 1 degree Celsius, but in remittent, it's more than 1 degree Celsius, and it doesn't touch the baseline. So the remittent fever is seen in septicemia, infective endocarditis, brucella, rickettsia. Next, intermittent fever. Here it touches the baseline in 24 hours. For example, malaria, tuberculosis, kala azar. Next, we have step ladder fever. Here, the fever keeps increasing in 2 to 3 days in step ladder fashion. There is increase and there is flattening of the wave. Then there is again increase, there is flattening. So it keeps increasing in 2 to 3 days. It's typically seen in typhoid. Then Epstein's fever. This pattern is similar to step ladder, but there is a febrile period in between step ladder fever for some 6 to 8 days. It's seen in Hodgkin's lymphoma. And the last part, the relapsing fever. Here, there is no fever for certain time, and then the fever again appears. There is relapse of fever. As you know, the classical malarial for a disease, Borrelia, rat bite fever, enteric fever, and lymphoma. And coming to the last part in the temperature examination, we look at fever periodicity, that is 12 hourly, 24 hourly, 48 hourly, 72 hourly. So if it comes 12 hourly and there is a gap of 12 hours, it's called double quotidian. It's seen in Kala-Azar. If it's 24 hourly, it's called quotidian. It's seen in falciform and vivax, Plasmodium falciparum and Plasmodium vivax. Then 48 hours later, it's called tertian fever. It is mainly seen in falciform, oval, and vivax of Plasmodium species. Then 72 hourly, we look at it in Plasmodium malaria, and it's called as quadrant fever. And with that, we complete temperature and fever part.